Hi there, it's Dr. Charles Modlin again with another health equity brief. I'm a urologist, kidney transplant surgeon, and health equity leader. These health equity briefs, as I indicated before, are opportunities for me to impart upon you, the listening audience, information that I think is important for you individually and for your family and community to maintain and improve your health. Today's topic is a very important topic. It deals with mental health concerns, and we know there are disparities when we talk about African American populations, men, women, and adolescents and children when it comes to disparities in our mental health and the various reasons for this. But today, the topic specifically is on John Henryism. So briefly, what is John Henryism? It's a concept that describes a specific coping mechanism that is often observed in Black Americans, particularly among Black men and women facing socioeconomic and racial stressors. It's named after the legendary African American folk hero John Henry, who is known for his strength, courage, determination, and this phenomenon reflects the struggle of many Black individuals to overcome systematic and systemic barriers through hard work and perseverance, almost to an excessive degree. However, this relentless pursuit can have detrimental effects on both physical and mental health. So again, who was John Henry? John Henry is a folk hero from American folklore, celebrated for his incredible strength and work ethic. The story of John Henry depicts him as a steel driver who competed against a steam-powered hammer locomotive to prove that his human determination and resilience could outmatch machinery. Unfortunately, despite his victory, John Henry ultimately succumbed to exhaustion, had a heart attack, and perished. And this symbolizes the toll that relentless effort can take on an individual. So, what is John Henryism? John Henryism refers to a proactive coping strategy where individuals, particularly Black men and women, exert considerable effort to overcome adversity and achieve success despite the challenges posed by systemic racism and socioeconomic disadvantage. While this determination can lead to accomplishment, it often comes at a significant cost to mental and physical health. One reason I wanted to talk about this topic is I consider my father to have been a victim of John Henryism, as he always felt that he had, as a Black man, had to work harder and longer than anybody else to prove his worth. So signs and symptoms, and again, I understand my father thinking this, the times that he grew up in the segregated environment. Born in 1924, he lived through the segregation and Jim Crow, and I totally understand why he felt that way. So signs and symptoms and consequences of John Henryism can manifest in various ways. Physical symptoms can occur from chronic mental anguish. Chronic stress can lead to hypertension, cardiovascular disease, fatigue, and other stress-related conditions and illnesses. Research indicates that Black men and women exhibiting John Henryism may experience higher rates of these conditions due to the ongoing strain of navigating oppressive systems. Mental health issues: individuals may face anxiety, depression, burnout as a result of the constant battle and struggle against adversity. The pressure to succeed can lead to feelings of inadequacy and hopelessness when faced with systemic barriers. Some of the behavioral observations: individuals may often work excessively long hours, neglect self-care, and prioritize work and achievement over personal well-being, leading to a cycle of stress and exhaustion. Again, the consequences can be profound and far-reaching. Health disparities: the persistent associated health disparities attributable to John Henryism contribute to significant health disparities among Black Americans, as I indicated, higher rates of chronic illnesses such as heart disease and diabetes. Can have impact on relationships. The relentless pursuit of success can strain personal relationships, as individuals may prioritize work over family and social connections. Economic consequences. While striving for upward mobility, individuals may encounter barriers that hinder their economic advancement, leading to frustration and potential disengagement from the workforce. How can we mitigate against John Henryism? And that's spelled Henrysm, John Henryism. So it requires a multifaceted approach. We need to promote our mental health, and that's through campaigns, community campaigns. As we as physicians and healthcare providers need to constantly remind our patients and ourselves and our families and our communities about how we need to promote our own mental health, but mental health awareness for others as well. We need to have encouraging and open discussions about mental health and the effects of chronic stress on individuals, and we need to all be able to recognize the signs of John Henryism and seek support. We need to promote access to mental health resources. We've talked about that in other health equity briefs. We need to increase access to culturally competent mental health services. I say culturally competent because the counselor, the mental health provider needs to understand the basis, the background, the impetus, the psychology as to why individuals feel that they have to become John Henry. We need to develop tools and teach individuals tools how to manage and navigate systemic challenges more effectively and the stress that comes along with that. Community support. We need to build strong community networks that can foster resiliency, provide individuals with a sense of belonging and shared experiences that can alleviate the burden of isolation. We need to encourage self-care practices. We need to promote self-care routines and work-life balance and help individuals prioritize their well-being alongside their ambitions. So we also need to promote advocacy for systemic change and engage in advocacy efforts aimed at addressing systematic and systemic inequalities, and doing so can empower individuals and communities, reducing the need for John Henryism as a coping mechanism. So in conclusion, John Henryism is a potent reflection of the resilience and determination of Black men and women in the face of systemic oppression. However, it also highlights the significant health disparities that arise from the relentless pursuit of success. By promoting awareness, providing resources, and advocating for systemic change, we together collectively can mitigate the effects of John Henryism and support the overall health and well-being of African American populations. This is something that we need to inform our youth, our children, because they can fall victim to this as well. Please like, share, subscribe, spread the word about this important topic and ways in which to mitigate it, signs, symptoms, and again, the reasoning as to why this occurred. Until next time, I'm Dr. Modlin. I'll see you next time for another Health Equity Brief. Thank you for joining me.